therefore the average cost for each premium would be unaffordable. And so we have to have a comprehensive approach. And just briefly, what we did was proposals similar to other proposals with a guaranteed issue of insurance, responsibility of employers, individual mandate, subsidies to help people that can't afford to buy insurance, to help them buy insurance, and increased market regulation, the same elements of the Republican plan in '93 and Governor Romney's plan in Massachusetts, along with other similar proposals. Virtually all have these common elements, and that's what we have in Obamacare. Some of the benefits, first of all, if you're a small business, people are talking about the effect on small business. If you got less than 50 employees, you're exempt. But if you provide health insurance, we give tax credits to those small businesses that provide coverage. Young adults can stay on their parents' policies till they're 26. There are caps on out-of-pocket expenditures so that when you reach the cap, an affordable cap, there are no more co-pays and deductibles. It's all on the insurance company. There's also no lifetime limit. If you have a chronic disease, many times people were bumping up on the maximum that the insurance policy would pay. After that, you have no coverage. You also have a pre-existing condition, so you can't get any other coverage. Now, under Obamacare, there are no lifetime limits and no annual limits. There are no rescission of benefits. A lot of companies figured once they find you pay premiums all these years, finally get sick, insurance companies figured if they can cancel the policy right then, they could save some money. So we have prohibited canceling people's policies for any illegal reason. You just can't arbitrarily cancel somebody's policy. Now, if they don't pay, that's one thing. But if they've been paying their premiums all along, you can't cancel their policy. And that was a real problem. You can't fail to cover somebody because they have a pre-existing condition. Whatever your health situation is, you can get coverage at the standard rate. Cost-sharing protections for families under $94,000. If we're going to expect people to be able to buy insurance, some people just can't afford it. So from around $30,000 to $94,000, there will be tax credits to keep the cost of the insurance from zero up to about 10% of your family income, so that it will be affordable. We're closing the donut hole under Part D. If you're on Part D, I think most of you know what that donut hole is. After you've gone through a couple of $1,000s worth of benefits, you end up with no benefits, still have to pay your premium, and then after a couple of $1,000s out of pocket, it kicks back in. But that donut hole is a real problem, and we're closing the donut hole. Security, you can get insurance regardless of your situation. A lot of people are in what's now called job lock. They've got insurance on their job. They can't leave their job because they can't get insurance anywhere else. Because of this, because of Obamacare, you can switch jobs without worrying about health insurance. Preventive care without copay or deductible. Preventive, when you get cancer screenings or your annual checkup, no copay or deductible. People are finding that they have cancer, but finding it out early when it is curable rather than late when it's generally fatal. And transparency, we can see what's going on and make sure that insurance companies are doing what they're supposed to be doing. Now, for Virginia specifically, one of the things that we require under transparency is that insurance companies, when they take your premium dollar, they spend at least 80 to 85% on health care, not corporate jets, CEO salaries, commissions, advertising, and other overhead. 80 to 85% to health care. A lot of them, for Virginians, $12 million was saved thanks to policy rebates. When we caught them not spending that much, they had to rebate to the policyholders. Virginians got about $12 million.